one of the things that we really talked about was making a change in the concession stand at the zoo. Well, I mean, that was outside the box.
We got a chance to have Brendan Wiley, who's the executive director of the Topeka Zoo, come to one of our meetings and just tell us about the zoo.
We started really thinking about what we serve people that come here to the zoo, and as part of the zoo experience, stop and eat. And one of the things that really came to the forefront of these conversations was that we are a zoo that centers around a philosophy of being good environmental stewards, really taking care of the environment and doing what is right. And what really jumped out at us was, with the animals that we care for, we put a huge emphasis on what they eat, on their diet, making sure that it is completely nutritionally balanced, that they get exactly what they need. And at the same time, for the people that come here, we weren't putting any thought into that whatsoever.
He really wanted to not just have the philosophy of the zoo and taking care of the animals be all about wellness and nutrition and conservation, but he actually wanted to bring that into his concession stand.
And so as this kind of epiphany occurred, that we're actually treating the animals at the zoo better than the people that come here, we began to change our philosophy with our food service.
He just really hadn't found the right platform to do it, or the right people to help him, or even to get it on his agenda for that matter.
And we said, okay, we know that money is an issue, and so what we will do is we will take our organization again, and we will write a grant to help you with this.
Not only were we able to work with this group that we called the Sodium Initiative, that was literally made up of people from local health department, Healthy Heartland Neighborhoods, CRC.
We were all very excited about what they wanted to do at the Topeka Zoo. So we took that information to Heartland Healthy Neighborhoods and to the communities, community organization, and say, can you figure out a way to help us?
The manpower and the relationship leveraged us to be able to go to Kansas Health Foundation, write a $25,000 grant, which then we turned around and gave to the city, to Topeka Zoo, to buy the large refrigerator unit, to buy the units they needed to keep the fresh fruits and vegetables.
We knew we had the opportunity to help him do what he wanted to do his vision, do his philosophy, and in the same step, really improve our zoo to be something that nationwide was different than anyone else.
He brought his entire staff into it too. We really tried not to work in silos, so it was only the top people, but we really wanted to get the staffs in and the people that were really on the ground. So I remember our first two meetings. We met with our entire staff, our contractor staff, and with his entire staff.
We let our staff literally pick the items that were going to be on the menu. We even, as we started introducing a new menu, worked with our staff to, not only taste for quality, but ask those questions. Would you purchase this? Would you eat this? And even how much would you pay for it? A lot of things like that, trying to develop good quality staff buy-in.
We immediately brainstormed on it. As Brendan was talking to us, we started pitching in ideas like, well, wouldn't it be neat if we could do a marketing campaign like Eat What the Animals Eat, and encourage our kids to eat healthy options not based on, oh, chicken nuggets are my favorite food, but I want to eat what the lion eats, or I want to eat what the bear eats.
Here's a giraffe, and here's kind of the nutritional pieces that make up a giraffe diet, and extrapolated that to a human meal option.
And at the same time, we took it over to the sodium reduction campaign, and we knew that we could utilize some of our funds to do a marketing campaign to really go off of that Eat What the Animals Eat and promote a good, solid, healthy concession stand menu to make the food fresh and not filled with preservatives and sodium that we were trying to fight with the sodium reduction campaign.
We made what was kind of a big symbolic move, and one day got rid of our fryer and replaced it with a convection oven. We started working with a nutritionist from a local grocery store that helped us piece together healthier options for people. When we first approached this, I think we started with a goal of something like reducing our sodium content that we offer by about 30%. Once we got in and really analyzed what we were feeding people, We were able to make that reduction just by removing our deep fryer, also by working with the vendors that we purchase from, sharing the story, letting them know what we're looking for. They actually kind of joined our team and even got to the point where they're bringing items to us. You know, it's not enough to say that you've lowered the sodium content of your menu by X%. What we're really looking for is making sure that those are the items that are getting into the hands and into the stomachs of the human guests that come here.
So the menu at the Topeka Zoo was very exciting. It was a complete flip of what a normal menu is.
So we did take some approaches with how we stacked our menu, making sure that better choices for people are at the top and above less healthy choices.
The unhealthy items were placed at the bottom of the menu, and most of them were taken off, including things like hot dogs and nachos and chili, because no matter how hard they tried, and they tried, to get those items to be low sodium, they couldn't find a way. So they just took them off.
We even changed the price points on less healthy items to make sure that, you know, the difference between an order of French fries and a fresh apple is not going to be made based on cost.
And now the healthy options were the easiest option, the lowest priced option, and the first option you saw.
In this type of setting, when people are hungry, they're going to order off the menu that you present them. If you present healthier choices that are lower in sodium, they're going to pick one of those. We want to try to take away barriers that prohibit people from making the right food choice. The challenge, if you will, and it's a great challenge to have, it's to always keep it moving forward. Part of our staff training process, when we hire someone to work in our food service program, early on they get indoctrinated into what is behind this community-wide initiative. And if we can have better menu items, better selections, we want that, and we want that to be staff-driven. Once the story started getting out, though, we got more positive feedback from making some of these changes than we ever would have imagined. It hasn't scared anyone away. You know, earlier today even I heard from a family group, a grandmother, her son, his wife, and 2 kids that were thrilled just by the ability to buy a fresh fruit cup at a zoo concession stand. As a mission-based organization that preaches caring for the environment, one thing that's important to us is really monitoring the carbon footprint that we are leaving on this earth. Part of this change has resulted in we deal with a lot fresher foods. Not only did we get rid of a fryer, not only are we preparing things more fresh, we were able to get rid of some of our freezers, replace them with refrigerators. We are storing things for shorter periods of time. And what we're hoping to see, and it may take another year or two to really identify this, but what we're hoping to see is not only is this better for people, but it's better for our environment as well. As we look back about this, you know, is about 2.5, maybe almost 3 years ago when this topic was first introduced. And, you know, every now and then there's that lingering question that, you know, why did it take a couple years for us to get this into place? It shouldn't be that hard. It shouldn't have taken that much time. We're glad that we made it, and we're glad that we're committed to continuing to improve. We don't think we're where we want to be just yet, but we're definitely heading in the right direction. You know, if there was one piece of advice that I would offer to anyone else that's considering something like this, it would be nothing more than just jump in and do it. It's never wrong to make the right decision.